now.
Okay. And I need to just remind everybody that we're being recorded and live streamed. So our Zoom practice has been that we don't do introductions. We're kind of labeled here, so we'll know who everybody is. I will mention that we have a guest, Michelle Fulkerson, who is the Mental Health Wellness Court coordinator, and she's going to be telling us a little bit about what's happening there. We're going to move her up on the agenda after we approve the minutes, so that she can move on if she needs to. So
thank you.
All right, so we have minutes to approve from May and June. Can I have a motion to approve those? Larry?
I move.
Second?
I don't know if I can second it, but I will.
Okay, Tom, thank you. Any discussion about them? Okay, all in favor of accepting them?
Aye.
Aye.
Okay, that looks unanimous to me. Okay, thank you. So why don't we move right into Michelle's presentation. She's going to be telling us a little bit about what's been going on, and there'll be time for questions after her presentation. So I'll turn it over to you, Michelle. Thank you for coming.
Thank you. Yes, of course. This came really great timing, because we just finished doing our year-end data from May 1st of 2019 to April 30th of 2020. So I just finished actually putting that together for the judge. So in terms of referrals in that 12-month period, we saw 38 referrals into wellness court. And of those referrals, 18 were accepted. So we have 18 people who are enrolled in wellness court. These are just Ithaca City people at this point. Of those 38, seven referrals refused to participate in wellness court. It wasn't for them. And then 6 of them were denied or found otherwise ineligible. We are planning to, so there was some legislation back in December that said that we needed to, now that we're a mental health court, we can be a hub court and take referrals from like town of Lansing, town of Dryden, town of Ithaca, all of the village and town courts for folks who may want to come into wellness court as an ATI. Gender and race speaking, our referrals for gender were split evenly, 50-50. We had 50% female, 50% male, which I guess from talking to some of my drug court counterparts, that's odd. Typically they see more females than men being referred, but we got a nice even split. And it looks like as far as race goes, we're in line with the county, county incarceration rates, as well as overall county population, with 71% of those referrals being Caucasian, 24% of those referrals being African American, 3%, I don't know, other maybe, and 2% being American or African American Hispanic. Let's see. So when we talk about people who actually are enrolled in the program, the numbers shift just a little bit, with 56% of those being female and 44% being male. So it's more in line with what the drug courts see. Race didn't, enrolled participants by race didn't change or fluctuate too much. 72% Caucasian, 22% African American, 6% African American Hispanic. We do this thing in wellness court. It's a PROS through the mental health clinic uses it. It's called the Quality of Life Survey. I get a baseline. It's a 15 question evidence-based questionnaire and they rate it themselves, and it asks questions about their physical health, medication, all sorts of different things in different domains of their aspects of their quality of life. And over the last year, we did a baseline, and then about every 3 months, I administer it again to try and determine whether or not people's quality of life is increasing or decreasing or kind of staying stagnant. And of the individuals who have baseline and at least a second questionnaire, all but 2 of our participants had an increase in their quality of life. And of those 2, 1 left the program and 1 is doing phenomenal. She actually was just advanced to milestone 3. I think it was just more the timing of when that second one was given. We also assess risk and need with folks who are coming into wellness court. I use the criminal court assessment tool, or CCAT. It's something from the Office of Court Administration. It's pretty in line with Compass, which I think other people, I think more people are used to hearing, Compass speak. Of our enrolled participants, 21% are considered as low risk for recidivism, 36% as moderate risk for recidivism, 36% as moderate high, and 7% are assessed as high risk. And during the last year, only 4 of our enrolled participants incurred new arrests, and no felonies. So they were all misdemeanor arrests. Of the 4, 1 has absconded. 1 participant was disenrolled, but then has since been referred and to remain in the wellness court program, and are doing okay. So that's all I really have for data. I can answer some questions, if people have some specific questions about process or what have you.
Could you tell us a little bit about what you actually do with folks in your role?
So I'm kind of their first point of entry. Once they are referred, I meet with them. I get a mental health history, a substance use history, and that is diagnosis and treatment. Like, what places have they been? What programs have they been in? I get a trauma history if they're willing to speak with me about it. I don't really push that, but it does help kind of connect the dots. I get a family background and what their current living situation is. Are they homeless? Are they couch surfing? Are they in an apartment, or maybe they're living with a partner who isn't, or family that maybe is not, they don't have a good relationship with, but it's, the best situation they can be in. I get their interests and their hobbies. That's when I also administer the quality of life survey and the CCAT to try and get just a snapshot of where folks are at. And then I go through the releases with them. So I spend a lot of time on releases because I just feel, it's kind of an important thing that, that they're not just getting paper pushed in front of them and said, here, sign this. I want, the participants to know, what we're asking for, what kind of context, we're going to be talking about them and talking with their providers about. A lot of it is a rapport. That's kind of the rapport building moment, and setting that foundation. We have to get folks to trust us in this court, or we're not going to be able to help them, and they're not going to engage with us. So that's really a lot of it is, yes, I'm going through these questions and I'm, and I'm writing things down, but I'm also trying to connect with these people. So that's the initial thing. And then we give them the handbook and kind of explain, how the process is. COVID has certainly messed up that process like everybody else's processes, but we've been able to take in some referrals, even through the pandemic.
Other questions?
So, yeah, I'm sorry. So are the people in the program required to engage in treatment, encouraged to engage in treatment? What are their options once they say, yes, instead of going to jail, I would like to go through this process? What are they signing up for beyond the initial assessment and the binder of policies and what they're doing?
Right. So yes, we ask that people are, if they're not with a treatment provider, we ask that they get an assessment, because, to be in mental health court, you got to have a mental health diagnosis.
Right.
So, and then, yes, we ask them to attempt treatment. If they've not been in treatment for a while, or, they just have never gone to treatment, we ask that they, start treatment. We don't push any certain provider. A lot of our folks are through Tompkins County Mental Health Clinic, but for some folks that doesn't work for them, or they just on their own went somewhere else, and that's totally fine. A lot of our folks have co-occurring substance use disorders, and I work with the mental health clinicians to try and figure out if this is something that the mental health clinic can do, because we want to get to a point of really solid integrative treatment instead of go here, go here, go here.
Right.
And many of the clinicians, are comfortable with, saying yes. We're building goals around both. We're building goals around, fighting this person's, depression and treating, their alcohol, use disorder. Some folks need to be referred to alcohol and drug counsel or CARS, in addition to their mental health treatment. So, basically, we are just trying to stabilize folks. We have people coming in who are homeless. We have Danielle Harrington's on our team. She's the housing coordinator for Tompkins Community Action.
Right.
She's been able to do amazing things for people. So we just try to meet them where they're at and figure out where the gaps are and what's needed, and then try to get them to that point. And yes, it requires them to give just a little. We're not asking people that, as soon as they come into the court, that they're abstaining, completely from substances, that, they're perfectly medication adherent, and they're making every single appointment. We know that this is a process, and it's just helping them along to get to that point.
Is your court open for visitors such as students?
It is, when we are in
When you get there, yeah.
Yes, when we have all sorts of people coming in. Judge Peacock just started in January presiding over the court, and he invited, I think, Dr. Brown from the Ithaca City School District to come in and just say hi. We have students. The ADA has asked about law interns, coming in and observing. But it's open court, so anybody can come in. I've invited some people from REACH and STAP because they're part of this community, to get familiar with some of our folks that are in the court, because they may want some type of services from, STAP or REACH. And it's a good way to just have everybody in one location. We can talk after court, what have you, exchange phone numbers.
Paula, did you have a question?
I did. It sounds great. I'm wondering what your biggest challenges have been and what would help you to be more successful.
So the COVID thing has been our big challenge right now. We're new, and with being new, there's some trial and error. There's some things that we get wrong. I think the biggest challenge that we've had is that I'm one person. And we just applied for a grant over the summer to ask for a case manager, because that would really help, having one person, because right now that person's me. I am interacting with 18 different people, plus taking referrals, plus trying to do court operations, and it gets a little sticky. So a case manager would really, really help. We are also asking to contract with Mental Health Association for peers. We want peers. We're asking for another partnership with Dr. Cohen from REACH for a trauma-based female support group. Because these are the kind of things that we're seeing, you know, that are needed. So.
Any other questions? Did you want to add anything, Frank, or?
Yeah, really just to say how great a job Michelle has done. Our court, obviously having the judges on board and being so supportive has been great, but Michelle has really taken this and run with it. And you've heard the successes. Not only are people not recidivating, they're also getting treatment and beginning to move along their goal plans, and all of that. Michelle's a one-person show, right? She obviously gets support from the clinic and community partners and the judges, but as far as making it all work, and that's all her. And so she's to be commended for getting us where we are with this. It's been nothing short of excellent. When you asked about the biggest challenge, and she told you the things, it's money, right? We need ongoing support for this program. Michelle took it upon herself to find and apply for this grant, which will be amazing if we are fortunate enough to receive it, and it will really amplify the court's abilities. But you know, we were already trying to push OCA for you know, a long-term investment in Michelle's position pre-COVID, and now that's probably gotten more difficult, not more easy. So, you know, I think as we go through budget season, we're going to need to support Michelle in this program to make sure that the county funding and hopefully the city funding can continue. And then, you know, as we move forward, try to find the additional resources that she needs to make it even more successful.
And just so you know, the grant was a $750,000 grant over the period of 3 years. So, and I don't think too many people applied. So we actually have a pretty good shot at possibly getting awarded. So.
Yeah, absolutely. And I think the transition between judges has gone well.
Yeah.
Judge Peacock taking over for Judge Miller was fairly smooth. He has kind of the same philosophy. So the judge is super important, as you all know, in these specialty courts. And so we've been extremely fortunate, you know, along those lines too. And then ultimately with the law change, being able to expand to the whole county has been, you know, a long-term goal, and will likely bring Judge Miller back into the fray, you know, as we move forward. But Michelle's one person, right? And while we want to serve everyone in the entire county, we have to make sure that she has the support and resources she needs to do that successfully.
Thank you so much for joining us and letting us know what's happening. It's great to hear.
Absolutely. I can come back any point in time, or if people think of questions later, you can email me. I like to talk about this program because I really believe in it, and I'm seeing it do well. So, you know, I'm available to answer any questions that people may have after.
Okay, thank you.
Thank you. Thanks for having me.
Yes, thanks for coming.
Thanks, Michelle.
Thank
Have a good
you.
evening.
All right, so back to our agenda. Frank, can you give us the commissioner update?
Sure. Couple of things. I continue to meet every other week with the mental health and substance use providers to kind of talk about where things are. I think everybody is still kind of in the same place where we're looking for long-term adoption of telemedicine, both video and phone, from the state. There's been some movement around Medicaid payments, but I think we still got some hurdles to go to get that put in place for us to continue to serve people the way we have been. Understanding that there are some folks that it's not working for, and we're, you know, hopeful to get back to in-person services as soon as it's safe to do so. the numbers, our intakes have started to pick up a little bit, but we're still way behind where we normally would be this time of year. And so we're continuing to look at ways to make sure folks are aware of us. Our PIO group has been pushing mental health services as kind of one of those foundational things around COVID as well. So if you haven't seen it in our social media, we now have a pictogram that we use for mental health needs that's out there. Ted Shealy is looking at the mental health webpage as well to see how we might be able to get that updated into something that's a bit more welcoming for folks. So we are trying, but there aren't folks right now seeking out those services to the levels that they were pre-COVID. We do have our clinicians do have caseloads, pretty significant ones. Much of that is because we don't want to discharge someone for disengaging during COVID. So, there is that balance of having to have a really high caseload coupled with how many people we're actually, seeing on a regular basis. So we're looking to balance that as best we can as we transition through the COVID response. The substance use folks are chugging along. Both of them, I believe, took vacation last week. So good for them to get a break. They've been going nonstop since this all started as well. But they are still seeing fewer folks seeking service, but they have seen more engagement from the people they are serving. So the telemedicine approach is working for them as well to a degree, understanding there's still folks that need face-to-face, and they'll be working to moving towards those as quickly as is safe. And then I also should let you know that Reach Medical has applied for an 822 license from Oasis, which would allow them to do outpatient services. I signed off on the LGU review a week or so ago, and I believe that is making its way through the state approval process now. They're not requesting funding with that licensure. What I understand is that in order to access a lot of federal grants, you need to be licensed by your state in order to be qualified. And so this would give them some access to some of that other funding because they are doing this unique and different approach, and there are resources out there for them. So keeping our fingers crossed that will happen for them and they'll be able to get that licensure. I think it will also help us with some of the concerns that I hear from the community about the way that their harm reduction approach is being applied. I have a lot of concerns about, I hear a lot of concerns about the amount of Suboxone, for example, that's being prescribed and or the integration with the other treatment systems. And having a license will bring them under the Oasis umbrella, and there will be some oversight. And I think hopefully it will provide more comfort to everyone, probably including Reach, that they're doing right by the people they're trying to serve and are a vital part of the treatment community here. So we'll keep you updated as I hear more about that process. The vacant positions, the clinic director and the deputy commissioner, the postings closed last week. We did get some applicants, so I'm going to be spending some time this week kind of reviewing those applicants and then having a conversation with the county administrator about the path forward for those recruitments. So we are actively working that process, and as soon as I get to have that conversation about budget and the future, we'll begin interviews. So for those of you that were on the deputy search, I got to dig up that list and remember who it was, but we may be convening in the next few weeks to start that process. And I think that's all that I have, Mary. Answer questions.
Is there any additional budget information, Frank, or?
Not really. I believe I told you that the county administrator had us submit 2 budgets, a 0, a flat budget, and then a 12% reduction. The good news is that even in that 12% reduction, it doesn't impact filled positions. We were trending in a pretty good direction revenue-wise, and so we had built some things into the budget that we wanted to do for 2020 that we're not going to be able to do because of COVID. So we were in a fortunate place because of that. But there's a lot of factors that are impacting the budget. Everything from the county impact with sales tax and what happens with county support, but also the governor. Now the state for our third quarter claim is withholding 20% for both OMH and OASIS dollars. So that impacts not only the department, but all of the folks that we contract with. So they will be seeing a 20% reduction in their third quarter payments. So that's another hit. And then revenue, right? We generate a lot of revenue with the services that we provide, and we obviously have not provided as many in the last few months as we had previously. Certainly not to the reimbursement levels that we had previously. So we've got to look at all that and understand what it's going to look like for 2021, and try to do some prognostication about all of those impacts. So right now we're holding steady with kind of the county administrators 0 and 12%. This is going to be an evolving thing over the next few months as we go through the process. As I said previously, you all don't necessarily have responsibility for the budget per se, but you certainly do for policy decisions that might affect service provision. And so if there are changes in services related to the budget, we would bring those to you so you have a chance to weigh in.
Larry, did you have a question?
I have 2 questions. One is, were you able to check in with CARS about the DNA issue? And the other is, I heard a rumor that MHA has given up its lease for the part of their office that is the Jenkins Center. And I'm wondering if that's true. And if it's true, what the status of the Jenkins Center is with MHA.
I hadn't heard that, Larry. Josephine wasn't able to be on our last call. So I can certainly follow up and check on that. I do know they had suspended the Jenkins Center operations because
yeah, I knew that too.
It just didn't work in a COVID world.
Right.
The last I had heard, she was evaluating how that might exist in the future. But I can certainly check in and see if there's been any change on that. In fact, I think we're scheduled to meet again next week. So we'll get an update from them.
And that would be great. I mean, I don't particularly care if they decided to give up some square footage, but the Jenkins Center is a necessary part of the MHA, so
yep,
I would like it to continue.
Sure. Yep. I'll check in with Josephine. And then I did check in with Jessica about the DNA piece. She did confirm that there's all kinds of security around it, and the information is not maintained beyond the use for their services. She's going to write something up. She was on vacation last week, so I wasn't able to follow up to get that written document she wanted to provide to all of you. So as soon as I get that from her, I'll get it forward on to you.
Great, thanks.
Any other questions for Frank? All right.
Mary, just one thing, just to let you all know, I am integrating back into the department, both department buildings. So you can tell I'm in my mental health office today. We're moving to a more virtual EOC with folks going back to their work. So I'm working to start scheduling regular meetings with folks and kind of get back into the more normal day-to-day in both departments. So I know that was some concern about my separation during all of this. So that's beginning to transition. Obviously, as things evolve, who knows, we might be back in the EOC again. But for now, I'm trying to integrate back into the departments.
How many of your staff are in the building? Is it still?
It's usually about a dozen or fewer. Most folks are working remotely. We have mainly the senior folks are here because they can provide support to all of their employees that way, and then also to deal with crises. We have begun to start to cycle people back into the building just so they can get a feel for how the building works in the new COVID world, a little bit at a time. And then, we're going to be having conversations over the next couple of weeks about what we're doing related to bringing staff back to the building and then ultimately bringing clients back. But we're not quite there yet, but we're planning for it.
All right. Travis?
Do you have any idea when you might start bringing clients back in the building? I mean, I realize this process sounds like it's evolving, but do you have any sense of when it might happen?
It's still going to be at least a few more weeks. It's hard to put a date on it. The county had a two-phased approach to its reopening, and so we submitted a Reconstitution of Operations Plan, or ROOPs as we're calling them affectionately. They are our phase one we've been doing since the get-go because we couldn't close, right? As some departments actually shut down for a little bit of time. So we've been in phase one and continue in phase one. I don't imagine the county will move into phase two until at least the end of the month. And at that point, we would be looking at some sort of process for bringing some folks back. I know PROS is chomping at the bit to try to bring folks back, and they're probably going to be the one we look to first. But they're also the most challenging because they have the milieu kind of built into them, and COVID-19 doesn't really give you the opportunity to do that effectively and safely without impacting a lot of people in a large part of the building. So we're going to work through all of those things, and hopefully in a month or so we'll be talking about who and how we're bringing folks back.
Okay, thank you. All right, so we'll move on to subcommittee reports. My intention for putting this on the agenda was not to have you all rehash what is in the minutes, but if you could just share some highlights with the larger board, I think that would be helpful for us to hear. Elise, could you start? Not sure if she's... Elise, are you there? Maybe not. Okay, Tom, could we start with you?
Sure.
Thank you.
My committee is not going to meet this summer or this July. I found it very difficult to try to contact people as speakers, so it's been difficult. So I canceled the July meeting, and we're going to meet in August. And I think I have August covered. At least I have some good ideas. I've had some tentative yeses for speakers, so I think that'll work out. Personally, my summer course just started today. I've got 14 students in a 15-week course in 5 weeks, so I'm going to be busy, real busy. The school still needs intern placement spots for the fall, and how this will work out, we're not quite sure yet because of COVID, but the students need the credit, and we need to have the service of the agency, so it should be very interesting this fall to see how this all works out. And I guess that's about it. Thank you.
Thank you. Larry, can you?
So just quickly, we had really great discussions with Sue Spicer about how the county deals with people who need injectables. For those of you who don't know, we are probably the exclusive provider of injectables for people who don't, actually for most people who need injectable antipsychotics and other kinds of drugs. And that process continues. So people are coming through the building. Susan talked to us about the kinds of medications they are currently using and some of the changes that have occurred over time in the way the drug is delivered once it's in the body. If you're interested, I'm sure Frank could arrange for Susan to put something together, or maybe do a presentation for the whole board, partly because I think it's so important that we all know, you know, all the aspects of what the department does, so that we can, you know, be telling people about the level of service that the department provides. We also had a really good discussion with Samantha Hilson who is now part of the larger department, but is primarily has been the health department's media person and public relations person. And we talked about how we're gonna build the public relations function across the organization. And I was very clear that we need to start putting some stuff about mental health on paper, because even though people can come to websites, sometimes it's helpful to have brochures. So hopefully Frank and Samantha took that point to heart. But also Frank is working with his PIO team about making sure that there is mental health stuff on the health department's website, there is mental health stuff on our website, and that those two websites are talking to each other. So it feels very good where we are at this point in terms of promoting the mental health aspects of the larger department going forward. And we talked, I think, with Frank about where we were with the staffing of the empty or the open positions, and he updated us. And I'm really glad that it looks like we have some candidates that might be good people to interview for the position, because that was part of the problem that we were seeing, along with the budget problem, which we may still have to face. But at least now we have some people, if I heard Frank right, who look like it would be useful to talk to. So that's very good news.
Good.
So that's it.
Okay, thank you. Elise, are you there? All right. Okay, well, we'll have to wait till next time, I guess, to get an update. Frank, was there anything from that subcommittee to share, or anyone else who was there?
Not that I can remember. I know the minutes were attached to the invite of all of this, so you should all at least have those to peruse.
Okay, thanks.
Yep.
All right.
Mary, if I can, real quick, I just wanted to share my screen and show folks. So this is actually on the health department webpage, but this is if you click on mental health and emotional well-being under the coronavirus tab, this is the infographic that the PIO team came up with. And so we were using that not only here on the webpage, but in all of our social media. So just like if you, let me go back to the homepage. So you've probably seen these four pretty consistently out there. Those are our COVID ones. They created this one for mental health as well, and are pushing it in the same manner. And it always points folks back here that, you know, gets them to information, including the resources page, which jumps you to all of our services, the hospital, family and children's mental health association, NAMI, the crisis line. So we are pushing that out there, and I really thank the PIO team. These infographics, particularly the the COVID ones have been the most popular thing in all of our social media. They're easy to share. They're fairly simple and straightforward. And so them coming up with this for us for mental health has been a big bonus and allowed us to get word out there much broader using the social media hits that we're getting these days because of COVID.
And Frank, correct me, or did I hear you say that Ted Shealy is working on the mental health page or looking at the mental health page?
Yeah, he's taking a look at it now. One of the things that we have to work through is the county is again going to be shifting its web presence. And so, yeah, I know. Ted's not happy about it either. If you haven't noticed, the health department webpage is probably one of the most robust county web pages out there. And Ted's worked long and hard to kind of get all that information out. And the newer version is more mobile friendly. And so you have to kind of shrink down the amount and type of information. So there's a lot of moving pieces going on, but the short answer is yes. The mental health webpage is on the top of our list to try to get updated.
Great, thank you.
Okay, Frank, back to you again on strategic planning process.
Sure, thanks, Mary. Yeah, so I think I mentioned a little bit about this at our last meeting, but we're looking to kind of re-kick that off in September. And so if you haven't already, you will find in your inbox probably tomorrow an email coming out that kind of announces that. And that will be re-engaging with the individuals that were selected to participate on the advisory group, as well as with staff that were on the internal group to begin those meetings again and try to get those scheduled. So Shelley, my assistant, will be working with the Batiste group to start to get those put on the calendar, understanding that people's calendars fill up quickly. We're going to be doing everything via Zoom. At least that's our plan for right now, just because we don't know where we'll be in September. If it is possible or prudent to have face-to-face meetings, then we'll attempt to do that. But we're going to start, having Zoom so we at least know we have a place to meet and have those conversations. Sam and I did meet with the Batiste group late last week to kind of help them reorient with us. And one of the things that we were clear with them about is that the idea of structural racism needs to be foundational in this transformation. And so they were excited about that and feel like they can bring some things to the table to help us do that, including maybe going back and digging into some of our mission and intent work that we've already done to make sure that it captures very clearly our interest in making changes in how we do what we do, so everyone has equal and equitable access to health in our community. So that will be a part of what we do in the strategic planning process moving forward.
Is there a deadline as far as completion of the process, Frank, or what do you think?
The strategic planning process? Yeah, when we kicked this off with Batiste, it was about a 3-month time frame. So their intent is not to languish on this. It's to help us work through it, get a plan in place. It's a 3-year plan, so it's not like it's what we're doing from now till eternity. It's really just getting us that framework because we want to spend time implementing the plan. So the idea is to get a good solid plan as rapidly as is reasonable and then begin the hard work of actually implementing it. So if all comes to plan, by the end of the calendar year, we should be looking at a strategic plan, or at least a draft that would be going through the review process for adoption.
Okay. Any questions? Okay. All right. Well, moving on to the last agenda item. We put that on the agenda because we have recently had a situation where someone from a community agency has applied to be on one of our subcommittees. And it brought up the question again I went back in our archives and found some documentation about the last time we talked about this, which was January of 2019. The question about membership on the board and the subcommittee, particularly questions about members of community agencies that may or may not be getting funding from us, but may have, there's just been over time questions about the conflict of interest potential of having members of agencies participate in that level. So I thought tonight we could start by just hearing folks, seeing what people's opinions are about that. Ultimately, when we have the strategic planning process all set, we'll be doing some revision of our bylaws where we would want to codify what our plan around this issue in a bylaw revision. But tonight, I think it'd be helpful to hear from folks and what's on your mind about committee and board membership.
I got something.
So who would like to?
I go. Mary?
I'm just, Larry, are you? Okay, Stu, why don't you start then?
Okay. Last substance abuse subcommittee, we had talked about this particular subject, and I know we've talked about this subject, certainly being on the nominating committee for a number of years. That subject has come up on a yearly basis. We have a person who applied for the substance abuse subcommittee and heard some objection because that person works for REACH. And as Frank was saying earlier, that REACH may become an OASIS provider, which brings up the conversation of conflict of interest. Just a little history that Mary and I were talking about, as well as, you know, you guys did your own research. You know, we had a board member who was the head of family and children. And at the time, I don't believe people talked about him being on the board and having a conflict of interest. Whenever he had a vote on something that was related to his agency, he abstained. I know in the substance abuse subcommittee over the years, we've had not executive directors, but members of the staff part of the committee. Again, we came to a vote that might perceive conflict of interest. They abstained. I was trying to get in touch with Larry last couple of days and get from him his history. I think there have been people on your committee that were agency employees, again, not executive directors. I think we've always kind of prioritized executive directors. And then when it became real obvious with family and children's person who was actually going to be a chair at one point in time, if I believe correctly. And long story short, he's no longer around. So having that criteria of you can't be a member on a committee or on a board certainly limits the available possibilities of people out there who can serve on the board or serve on the committee. We've usually had a powwow. I know Mary and let's see who else. I think just the two of us are on the committee.
Jan is also.
Yeah, Jan, I think, is having trouble with her internet. She said she crashed a couple of times. And I think before that, we had, who else was on the board? But all, you know, very good people who know people in the community. And as we call it, you know, shake the bushes and try to get some volunteers, people of color, Asian, a variety to have on the board. It's been difficult getting that kind of criteria. It's been difficult getting people to join the board or the committees. I look at my committee that I'm on with Tom, and I think, Tom, we have 5 members out of 9. So we have, vacancies to fill. So
Sure.
we try not to be too choosy about that, but certainly we have our own criteria. One is which a person actually attends a meeting before they can be considered to be on the board or in a subcommittee. So I think last meeting we had, what's her name? Jessie from, and we talked about how we were going to submit her name to the board tonight. But I kind of heard from.
Yeah, we should probably be careful about anything too specific.
Right. Well, she attended the meeting, and that's open record. The fact that she applied, that's open. We've had people from Reach on the committee in the past. I certainly didn't see any reason to not have her on, except when I think Frank towards the end of the meeting said, well, they're going to probably be an Oasis provider, and maybe the council would also want to have that kind of status. They seem to be, my history, satisfied by just attending, and they attend every meeting. There's always a representative from the council there, as well as CARS. And when it comes to voting, they don't vote, but they certainly have their opinions and their input, and they're welcome. They're important, integral of our system in the community of substance abuse. So I wouldn't really want to prohibit people from being on the committee because they work there. It can be a conflict of interest, but on the side of, we need people out there to join committees and boards. I certainly, board goes along with it, putting some kind of provision on there. I've thought about 2 ways in which we can change our code of ethics or our policy. I forget what do we call that document? The bylaws. Either to eliminate anybody from an agency who is getting funded, or to have them abstain from voting. I certainly would lean towards that and make it more formal, because that's what has been happening in the past. They just, okay, I'm going to abstain. So you're putting it in writing that they're going to be abstaining from anything that might be a conflict of interest. But again, I'm on the side of, we need people, and it's hard getting people. I was just reading.
Stu, I see a couple of other folks who are wanting to add. So your position is that you would like to be more open to membership from agencies with
the caveat of they can't vote for
okay.
agency or for board, and I know, Larry and I just exchanged email. They just got a chance to see your email just before I got on the board. So I think, Larry's got some interesting things to say about it as well. So I'll
All right.
listen.
Thank you. Larry, you want to add? You're on mute.
Okay, in the midst of previous decades, we used to have a very clear understanding. I don't know if it was ever written down, but we used to have a very clear standard that we would not appoint to a subcommittee or to the board a board member or a executive director of an agency, for the reason that both of those parties have fiduciary responsibility to the agency. So but that's become lax over time. I think what should happen personally is we should just say executive directors won't be considered for obvious reasons, which we can make up whatever, I mean, not make up, but we can write down what that reason is and stick it in the board, in the bylaws after consulting with the county attorney. And then, like right now, I'm thinking at least 2, if not more, of the members of the mental health subcommittee who are very important to the subcommittee are members. And they both work for agencies in fairly responsible positions. But I never feel like they are overstepping, because we don't often vote on, like we like Mental Health Association, but we don't like Reconstitution. The subcommittees, as far as I'm concerned, don't usually get into that kind of discussion. But over time, I think there've been all kinds of staff people on subcommittees and on the boards. I mean, Mary was at Record Center and Chris was at Record Center, and lots of people were at different places during their really effective board membership. So I'd like to suggest that in September, we come to the board, or somebody come to the board with a Tracy, never mind. I got in trouble talking about Tracy Decker when she wasn't visible on my screen, so I'm not going to do it anymore. Anyway, she just popped up on my Facebook page. Anyway, I'd like to suggest that we have something that says executive directors can't be on the board for whatever real reason or on the subcommittees for whatever real reason we write, and call it a day.
Okay.
Because I feel like there's very good reason to have staff members in voting position. And I don't think it's ever really caused us to think, oh, well, they shouldn't be the chair of the board in the way that having an executive director caused us to think that. So that's my position.
Okay, other thoughts?
Yeah, I'd like to say something.
Sure, thanks, Sheila.
Yeah, you can hear me?
Yes.
Okay. Yeah, we've had this conversation before, and I guess I'm falling somewhere in the middle. I think Stu's comment about lack of candidates is a concern. And so if it is a concern, which I think it is, because I've been on that committee before, then I don't think we want to be so restrictive that we lose people that would add something to our committees. Maybe we can make a distinction between the subcommittee and the board and make it a little bit, wider, kind of more open to people, certainly staff members, maybe even executive members on the subcommittees, with some caveats, perhaps, like Stu said, they couldn't have voting privileges, and perhaps be a little bit more restrictive when it comes to board members. But again, my concern is we just don't have the candidates. And I think, if that, we either have to do something to attract more candidates, or we open it up to the few candidates we have.
Okay. Any other input from the board?
Hi, it's Harmony. I'd like to ask a question of Frank. Frank, how does the health department do it?
We don't have subcommittees at the health department. All we have is the Board of Health. And there isn't a direct contractual relationship with anyone or licensure. I mean, we do permit. So for example, we have a restaurateur. We like to have a restaurateur on the board. We had one for 20 plus years. He just recently left because it gives, it gives that perspective. But the Board of Health is a little bit different in that it is strictly the board. There are not subcommittees that are associated with it, and we don't have the same type of organizational oversight that the Community Services Board has because there aren't organizations really doing what we do. It's really more of a permitting relationship. And so even in that instance, the restaurateur would have to recuse himself pretty frequently because of potential conflicts, not just for his business, but for potential competitors, right? Because there is that's part of it. And I think that challenge exists for you all as well, right? It's not just about anything that could affect your agency. It really is about anything that could affect an agency that could be seen. Competitor is not the right word, but obviously anything that is, negatively impacts someone that does the same thing as you could potentially be a benefit to you, depending on how that falls. So it's a little bit different, but they do deal with the recusal piece. I will say I did talk with the county attorney, and while he didn't say that there's necessarily a prohibition, he did say that there are many instances on votes that people would need to recuse themselves, not just for things that are directly impacting them, but that anything that could potentially impact them, like something that impacts policy or another agency. And they do provide, the purpose of the subcommittees is to provide input to you as a board, right? And so you are the main voting entity, and being a voting member of one of those subcommittees does have the potential influence on your behavior or your actions from a voting perspective. So there is concern there. Another point that I wanted to bring up, Stu, you mentioned about the Drug Council. They will want to be on the board if you open this up, as will CARS, and I would imagine almost everyone that you have a regulatory environment over. If I worked in an agency like that or was in charge of it, and there was an opportunity to be a part of a voting member of those committees, it would almost be neglect to not submit a name. And I think where you are going to run into some challenges is you're either going to have agency heavy boards, because many of them are going to want representation, and or you're going to be forced to choose amongst them for limited seats on your subcommittees. Neither of which I think are positive for the work of the subcommittees, right, and what it is they're trying to achieve. In my mind, the subcommittees and you all as a board are supposed to be community representatives to help guide the work of the department and the agencies that we oversee. And that includes the subcommittees. And so if you have a significant influence from a voting perspective from those agencies, it diminishes a bit the community voice. And I would argue that the lack of applicants is something we should fix versus potentially filling seats with folks that, quite frankly, we can compel to come to those meetings, right? And the reason the Drug Council and CARS comes is because there's kind of an unwritten rule that as the agencies
Yes.
providing those services, you're supposed to be at those meetings. And if you remember, when Cody came along, Sharon and I compelled them to come to the subcommittee meetings, right? Because we can do that.
Right.
And so I think there is a distinction to be made here. And obviously you all can decide however you want to move forward with this. I would point out that ultimately the legislature has to agree to the approach of this and appoint these individuals. They've never, I don't believe, ever not appointed somebody you've sent forward. But I know conflict of interest is something that is of importance to them. And, I would just want to make sure that we had a well thought out plan that we proposed to them before we sent names forward that might potentially fall into this category.
I also wonder if we just say executive directors, some of the larger agencies would have a CFO or a VP or whatever, and that would open it up to people in pretty much the same amount of power or the same amount of knowledge, however you want to think about it, so that becomes tricky as well to just say only executive directors. It seems like you have to either broaden that or just say we're not doing, we're not doing those people.
Right. Larry?
So I completely changed my mind listening to Frank, and also, is that you, Jen, or somebody else that just spoke?
It was
Who just spoke?
me, Jan.
Hi, Jen. I can't
Hi,
see.
Larry.
I didn't know who it was. I think what we should do is have a small group of maybe the chairs of the subcommittees and the nominating committee and whoever else wants to join us, including Mary, and sort of hash this out between July and August, or July and September.
I think after hearing, can I?
Harmony, go ahead.
I don't know how to raise my hand on Zoom. I know there's a raise your hand feature somewhere. Yeah, after hearing what Frank said, I mean, I think that was a really well thought out argument. And also, I think it's more than just the power to vote on things. It's also the influence and the information that you get access to. People like you on the committee or a board, and you create these relationships with people, and then there can be subtle ways that influences other board members' decision making, and you get access to a lot of other information that other groups who, let's face it, nonprofits compete with each other as well. Like, we don't like to use the same kind of business words, but nonprofits are businesses as well. So I feel like it's kind of like hard to distinguish what influence it can have on people.
Mm-hmm. Yeah, that's a good point. Okay, Travis?
I just totally want to support that opinion. I think there's a fine line between gathering information and having somebody be a participant from being influential. And that can be very subtle and nuanced, and it can be kind of overt, whether it's fiduciary or whether it's policy, as Frank was talking about. So I think having something clear is helpful for everyone, but at the same time, it's such a small community. I mean, I wouldn't want to see it so small that we couldn't work together somehow with people. I'm not sure what that would mean necessarily, but whether people come and participate or come and provide information, but then are limited in some way, and how that, I'm not really sure what that would mean. You guys have more experience on the board than I, but I think we want to model being collaborative, but I also think we also want to protect the work that we do.
Mm-hmm. Okay, thank you. Tom, did you have a?
Yes, I think that people should be allowed to attend and participate and share their expertise, which is what we need, but not vote. If you're in the higher echelon of an agency,
okay,
they have a lot to share, and it could be very, in some cases, critical to some of the decisions we make. But, I don't think they should vote. I think the committee itself should vote. That's it.
I'm wondering too, if Frank, you could talk a little bit more about the recruitment piece, because that seems to be the issue, one of the major issues here. We just don't have enough applicants to fill positions.
Yeah, so there's a couple of things there, and I'm gonna start with the first one. I hope nobody takes offense, right? Oftentimes, the ability to recruit is reflective of the work of the committee or board that you're trying to recruit to, right? You have to have something that's of interest to people, that has value for their time spent. And so I think we have work to do with that. I think Tom, Elise, and Larry are working towards that, and I'm certainly committed to supporting that as well, because we want the committees to be valuable for everyone's time, yours included, because time is valuable, particularly in these days. So that's the first piece of it. But I think more importantly, it's expanding our kind of reach when we start looking for these for candidates, right? I think we often go to the same well over and over again, and the agencies are kind of an easy place because we all know them, we see them all the time, and we serve on their boards, so we ask them to serve on our boards, and it becomes a kind of a closed group. I think, and it shows that on all of our subcommittees and this board, I believe, the component we're missing is either our individuals receiving service and or family members of those people. So I did reach out to Beth McGee, who is the new executive director of NAMI, to help kind of try to identify some folks that might be interested. Because quite frankly, we need that lived experience. Not that you all don't have it, you absolutely do. But I think, and to Larry's point in the email prior, we need people with different lived experiences, with different backgrounds, that are different from us. That are people of color, of different ethnicities and races, so we can make sure that as we're trying to move forward in a more equitable manner, we have those voices to help guide us and provide those inputs. So I would suggest that we have work, and that's the collective we, me included, in trying to reach out to different places to find folks that might be interested, and not the same folks, right? I mean, we all know the folks in our community, unfortunately, that are people of color that everyone goes to ask them to come be on their boards. We got to do better, right? We have to find more people that have different experiences that would be interested and willing to come join our conversations on how we do things better. So I'm committed to that, and I know the county's committed to that, and we have to really put our nose to the grindstone to figure out how we're going to do that successfully.
I think one way that it might be more attractive to people is talking about this change that we're going through, or through, I don't know, I guess we're not all the way through, of the merging of the two departments, because that I think would be of interest to people, and we would benefit from more input for that as well. But it also seems like a drawing point for some people. They might want to be a part of that.
Yeah, very true. So it sounds like we've got a couple of paths we're going on. We're looking at how do we encourage more participation, involvement. There's certainly our nominating committee is where some of that happens, but I do see it as a responsibility for all of us to take that on and do some of that work. And then Larry, you were talking about a smaller group maybe coming up with a statement for September that would explain.
I think some people should be added to the nominating committee, and we just call it a group that will work on both this issue around the language of executive directors or staff, and then also look at how do we increase recruitment. And because we have 7 or 8 openings between the board and the subcommittees, and it would be nice to fill some of those with, people who haven't been involved in this process. I mean, this is an opportunity to really diversify the board. So I think we should do both. I think there should be a smaller group to do both, to do some thinking about both those things. So when we come to the September meeting, we have some solid suggestions to make about how to proceed.
Yeah. And Mary, I can kind of help with both of those things. I can get a group together if it's the nominating committee and the chairs. Mary, I'm assuming you'd want to participate, to have a quick conversation about kind of the participation from an agency perspective. We can get something written down and get that done probably in an hour conversation. I can get that set up through Shelley. And then secondly, I can work with Sam and probably Dr. Clark over at the Human Rights Commission, as well as our HR department, to maybe put together a flyer, for lack of a better way of describing it, to get out there about all of the different opportunities, both the board and the subcommittees, the type of people we're looking for, and kind of what the boards are about and what they might have an opportunity to participate in, including the merger and health equity and those kind of things that might bring folks to the table. And then we can all use that as our recruitment tool to try to get folks to participate. That sounds like a plan.
Yeah, I like the idea also, Frank. I think you have some good points there about the flyer. And how many years I've been on the nominating committee, or certainly on the board, that we've had our ebbs and flow, but we rarely have an abundance of people to pick and choose from to be on the board and on the committees. I know you tried yourself independently to do what you could to find interesting people or interesting parties for the variety of positions that are open. And I think we still need to try some fresh approaches to figure out how to stimulate those to, want to give up at least an hour a month at the board level, or an hour a month on the subcommittee level, and an additional time to put into some of the committee work that takes place from time to time. The folks that are attending, particularly on the substance abuse subcommittee, they're motivated. Like you said, they have agencies. They want to be able to speak for themselves. They never really had any difficulty attending those meetings, but just the small title of a committee member seems to get people to the meeting versus not having any title whatsoever. It gives them a kind of a responsibility. Okay, I signed up for this. Let me go to the meeting, take notes, and give some input as well. It's small, but I've observed that if you give them that slot as committee member, they show up. If you ask them to just show up because you're interested, unless they're, again, part of an agency, they're not showing up. And it's
Right.
interesting that now some members of the agencies want the shall we say, committee status, whereas in the last 30 years or so, really they didn't make that kind of question or ask to have a seat at the table. There's some, perhaps politics involved in that as well, but I'm not going to speculate more than that. But we should find ways to find more people for our committees and our board. And if we do some brainstorming with the nominating committee, with the help of some of the chairs, we would probably, I think your input, Frank, you had some good ideas there. We can perhaps move this forward, and settling on whether to change the policy or not, I think is still open. But I think we should be more concrete eventually as to whether we allow it, whether we allow members with any affiliation at all to be on the committee. If we had abundance of people, I really don't think that would be a big issue, whether or not we can draw that line. But for now, we can use all the help we can get on the committees.
It seems like another step to this is to have some sort of an orientation, because if we're talking about getting a different pool of people, sometimes people are intimidated by things that they don't understand or they haven't taken part in before. And so they're reluctant to get involved. And that's why I think it's so easy to get the people who are involved
Right.
because
Right,
they're
'cause they
used
know
to
how-
boards and committees and so on. If we're looking for some more diversity, I think that we need ways to explain what we do. And one thing would be to say, you know, you'll have an orientation. Nobody expects you to, you know, start right in knowing exactly what to do, and give them a mentor or someone on the committee or the board to work with them.
Yeah, I think a mentor is a great idea. You know, it just takes time to know what's going on. And if you do have someone who's checking in after meetings, what did you think? What questions came up? That could only be supportive. That's great.
Yeah.
Good. Okay, so it sounds like we have a plan for next steps, and we'll put this on our agenda for September so we can report back on what we've been doing and see what we do next then. So,
Mary, just before we leave that subject, I feel like there's something I just need to add to the record. The REACH folks, for some reason, feel like I don't support them in what they're doing, and I absolutely do. I absolutely do, and I don't want this to be because it was REACH that had applied that somehow this gets misconstrued. I was fully supportive of Dr. Ryan being on the subcommittee when they were not applying for a license. I was supportive of trying to get someone to replace her from REACH when they were not applying. It is because they have now applied for a license that this comes up. It is not particular to REACH or anything that they're doing. It is strictly about, you know, their status as a soon-to-be licensed OASIS provider. So I just wanted to make sure that that was out there. I fully support what REACH is doing, and I look forward to them being a licensed provider in our community.
great, thank you.
Okay.
Good. Yeah, I also think that they, you know, this has been an issue that we've kind of touched on and intended to get back to. So it was just an opportunity for us to really revisit this and get to a more solid place as far as what we want to be doing. So
What will we tell that candidate then? Is that an awkward thing that they won't know for 3 months? Like whether is that what you're saying more or less, Frank?
No, I'll reach out and make sure they know. There's another candidate that works for another provider that hadn't put an application in yet, but was making inquiries. So I will reach out to both of them tomorrow to just let them know kind of where we are, encourage them to come to the subcommittee meetings, whether they're members or not. Their input is certainly welcome and valuable, but that the board is still considering, you know, its process for appointments moving forward. And until they have that in place, they're not going to be putting names forward.
Okay, I just didn't want somebody to sit for 3 months wondering.
Yeah, no, that's a good point, Jan, because like usually they apply and we as a nominating committee looked at it and said, yeah, okay, let's present this to the board, and that process, you know, has stopped. So I think it's good that Frank is going to share the latest with at least that particular candidate.
yeah, thanks, Frank.
And I'm taking a course right now. It's just interesting timing. I just started it today through Cornell, and it's on board governance. And they have a lot of little tools that I will shoot out to the group on how to identify who you need for a board, and also how to do an orientation for board members, and what are the main expectations and things like that. So maybe that can be helpful in the process too.
Oh, thanks, Harmony. Great. Good.
Are you seeing the comments in the chat that Sheila said she could do a DD subcommittee update because Elise was having problems with hers?
Thank you. Yes, that'd be great, Sheila. Thank you. Before we end here.
Yes, certainly. Thanks, Jan. Yeah, that was also, Jan, I really liked your idea of the mentoring and providing some sort of orientation. I think that would be very, very helpful to incoming subcommittee and board members. Just very briefly, the minutes were very thorough, thanks to Karen. But at our last meeting, some of the, aside from brighter updates, especially living in, COVID world, concerns about funding, we'll probably be discussing the implications of OPWDD cuts in future meetings. We also talked about the lack of summer recreational opportunities for students and the impact that it was going to have. And I'm also just an update on summer school, ICSD. Did opt to go ahead with in-person summer school services for students with disabilities, and it might be a soft start to the reopening in the fall. Although BOCES opted for remote instruction to continue with that. So lots of things to consider as we move forward.
I know that Ithaca, the city of Ithaca, the recreation support services at Ithaca Youth Bureau are going to be restarting sometime in late July.
Oh, that's really good news.
Yeah, I just heard it from my son myself. So.
Yeah, excellent.
Great. Anything else anyone wants to add? All right. Well, thanks for the conversation. I feel like we have a better understanding of where we may want to go. So thanks, everybody. Can I have a motion to adjourn for tonight?
I'll move.
Travis, second.
Second.
All right, Tom, thank you. And
Thank
everyone,
you, Mary.
thank you. Have a good rest of the summer. I'll see you in the fall, September 14th.
See you September.
Okay.
Thank you.
Bye.
Yeah.